Hello, my name is Dr. Shyama Mathews. I'm one of the physicians at Women's Healthcare of Princeton. Today, I'd like to discuss the Pap smear. A Pap smear is a test that's done for cervical cancer screening. It's done by your gynecologists and involves a speculum exam, where a speculum is placed into the vagina so that the cervix can be visualized. The cervix is the bottom portion of your uterus. Cells are collected from the surface of the cervix. That's what's tested and looked at under the microscope. An additional test that can be performed at the time of a Pap smear is to look for human papillomavirus. This is a virus that's transmitted sexually and can increase the risk of having cervical cancer. A Pap smear should be done starting at age 21. New guidelines don't suggest that a Pap smear should be done any earlier, even though previously we used to start at much younger ages. We used to also do Pap smears every year. New guidelines recommend that we do them every 3 years. This is because our testing has improved and we found that we can often rely on our immune system to improve the cells on their own, even if we have some mild abnormalities. There are certain reasons why some patients need to have annual Pap smears. One reason is if there are abnormal cells found on your Pap smear. Another reason is if your immune system is weakened because of another type of virus in your system, or if you're taking certain medications that harm your immune system. Smokers as well should consider having an annual Pap smear because smoking can also impact your immune system. Patients that were exposed to a medication called DES before they were born are also at higher risk for having cervical cancer and therefore should have annual Pap smears. At what point can you stop having a Pap smear? Patients who've had a total hysterectomy, meaning that their cervix was removed for reasons not related to cervical abnormalities, can stop having Pap smears. Also, some doctors stop performing them after the age of 65 if previous Pap smears were all normal. If you don't have any new risk factors, that might be something that you can consider. Have that conversation with your doctor. Once the Pap smear is performed, within a few days you'll get a result. If the cells are normal, no further testing is necessary at that time. You can have another Pap smear in 3 years. Abnormal results are often very confusing and concerning to most patients. They're very much anxiety-provoking. Abnormal results can mean lots of things. It can mean that there are some mild abnormalities in the cells, which means that often an additional step, such as a colposcopy, which is a procedure where we just look at the cervix more closely with a microscope. We sometimes apply a solution that helps highlight cells that may be abnormal, and biopsies can be done. This is done in the office. It's typically not overly painful. Some ibuprofen or Tylenol is typically all that's necessary. It's done without any sort of sedation, and you're able to go home on your own that same day. The biopsy just helps us know if there are any cells that are further along in the scale of abnormalities. If it comes back normal or comes back at mild levels, it just means a new Pap smear needs to be done the next year. Anything further along from an abnormal standpoint may require a further step, a more invasive procedure called a LEEP conization. That's where a portion of the cervix needs to be removed and further tested. This is not that common. Your doctor will explain your Pap smear results if they are abnormal. And if additional testing is required, they'll help you schedule that, and you can have that conversation in the office with the doctor. Again, Pap smears are important. They're important to help with screening for cervical cancer, and that helps us stay healthy.